Good morning. Myself and Shauna Rader Kelly will be presenting on Fidelity. Shauna is sick today, but she's on, so she will be intermittently adding and doing some of our information. Just a very brief introduction of myself. I am currently working with MTSS, but have spent many years working as a school psychologist and with the RTI project. So, Shauna, do you want to introduce yourself?
Sure. My name is Shauna Rader Kelly. I'm a psychologist at Bozeman High School, and I've also been working on the RTI project and have been working with Project Real for the last couple of years.
So today our goal is to assist schools, MTS schools, in implementing evidence-based practices with Fidelity at all tiers. So when we take a look at our objectives, we want to integrate Fidelity measures for the process and for implementation. We also need to identify the difference between Fidelity and our standard protocols of treatment. We need to discuss strategies for assessing Fidelity to a variety of system components. Now, I think first of all, we've got to truly define what Fidelity is. Fidelity is a strict observance of promises, of the duties that we have to the community, to our school board, to our individual school buildings, to our staff, to our parents, and most especially to our students. We need to remember that when we are utilizing Fidelity, we absolutely are relying on facts and details and data, which leads us into any of the processes that we utilize through MTSS. We are doing them with accuracy and absolute exactness. The fidelity of implementation is also known as treatment fidelity, and that's basically, are we utilizing everything we are doing at our systems level as it was designed and as it was intended. Too often, fidelity is assumed rather than truly assessed. Outcomes just cannot be attributed to the intervention unless we're monitoring what we're doing, how we're doing it, and so we can make the decisions as to whether poor results are actually a part of the intervention, or has there been some modifications to the intervention? Did the child or grade level or system not progress as intended because of human error, or because the intervention wasn't what the child needed? See, we cannot assume treatment will work if we haven't assessed what and how it has been implemented. Oops, I need to go back. Part of fidelity of implementation guides us in parents, teachers, systems, communities, all taking a look at being able to trust the system and trust the data that we provide. Fidelity provides accountability. I was so glad to hear in our prior presentation about using data to make decisions, and that's exactly what we need to be doing. Fidelity assists us in developing system-wide roles and responsibilities. So each person involved in the process knows what their job is, so it's not questionable. And we have to evaluate the continuum of improvement for the system. As we as the school, are we getting better academically? Are we showing improvement in our office referrals? Is the mental health and culture of our building looking better? These are all things that we need to continually evaluate with Fidelity. And most important, are our kids getting better individually and by groups?
I think that this is also a good time to mention that Fidelity is not necessarily just about the intervention, but it's also about how we function as a leadership team. The schools that are participating today are sustaining schools, and so you have been through a lot of the foundational work, but intervention drift, just as it exists for teachers who are implementing interventions or for related service providers who are implementing interventions, also exists within the system. And so when we're talking about Fidelity, it's also a good time to talk about the fidelity to our process. So for example, you may have begun the implementation process with regular meetings that followed an agenda and a problem-solving model with high rates of attendance from the leadership team. When you're talking about fidelity, think about assessing those kinds of things as well. Are those meetings still occurring as frequently, with the same efficiency, with the same rate of attendance that you had when you started with implementation? Go ahead, Susan. Thank you.
And I think to jump on to what Shauna just said is that, you know, I think when we're looking at leadership teams, we need to know that leadership teams look at your system-wide issues. They are the ones that continually have to look at what is real about your building. You're the ones that are analyzing the data that comes from your mental health type surveys and making the decisions about what needs to be done. You are the ones that are looking at your benchmarking triangle for academics. Therefore, you have to be utilizing Fidelity in how you process that information to make decisions about what has to happen within your building. So when we are looking at teams, often schools have two different kinds of teams. They have the leadership team that works with your system-wide issues, and then they might have a student problem-solving team that may look at grade level issues. They may look at, you know, specifically read. They may look at some of the different areas of academics and individual student planning. So differentiating, we go back to that role and part of the systems as how teams operate. It's very easy to let that slip and just jump directly to the child who is having difficulty. So I think it's very important that as a part of your teaming and your system-wide piece, that your meetings are put into place on your calendar with the same kind of fidelity that your football games are. Because you have to have things set in stone so that they do not drift away and that your process does not drift away. In a few minutes we'll talk just a tiny bit about the TIPS program, because that's exactly what you need to utilize for all of your discussions at every level, school-wide, at intervention level, at student level, at reading, whether it's math, whether it's behavior or mental health issues. So all of those pieces have to be set in place and done with a systematic process. So when we are looking at some of the basic types of fidelity for districts and schools, fidelity of implementation of the crucial components of the MTS process system-wide. We need to be looking at that big picture in your system-wide process, and that's your school-wide system. That can be called Tier 1. It can be however you choose to name it. But it's a matter of looking at your system-wide issues. Are you evaluating all of the components that go into MTSS? Have you set up some sort of self-check that you are addressing all of the critical components of the system-wide process of MTSS? We have to look at assessment fidelity, and by assessment fidelity, we need to be truly taking a look at our benchmarking for academics. Do we have that set in stone? Do we have a systematic process to analyze that data and problem solve where our gaps are, and then put in the types of interventions or system-wide teaching that we need to have happen? Do we have a system in place to take a look at our survey information that assesses the culture of our building, our staff, and how our students are perceiving how we're doing? Do we have a process utilizing problem solving to address those, so we're not letting those slip away, so we are not like minimizing some of the things students are saying? Are we minimizing some of the things that our staff is saying, or are we truly taking a look at what the culture of our building and the people in our building are giving us information about? We need to have fidelity of problem solving across all the tiers. And through MTSS, it is highly recommended that you use the TIPS or something similar, whereas you are having the overlay of problem solving to every need that you have. Therefore, you are utilizing a systemized process to take a look at the data that you have accumulated, because data does nothing if you don't move it into a problem-solving process. And then finally, we have the fidelity of evidence-based instruction and the intervention matched to the individual needs of our kids. Do we have systematic programming, curriculum, and instruction for academics? Do we have systematic instruction and curriculum that is reliable and is valid, that addresses the behavior and management needs within your building? You know, these are all questions that your leadership team truly needs to address and be taking a piece part of. Okay, Shauna?
So oftentimes it's easy to confuse protocols with fidelity. And while protocols can help us to assess fidelity, it's important that we have plans in place to ensure that we have fidelity to our protocols. So protocols are really it's your plan. It's your MTSS plan. It's how you plan to execute implementation. What fidelity allows us to do is to assess how we have executed the plan. Have we done that in a timely manner, in the way that the plan was laid out, in the way that in which it was intended? Protocols are the established code of procedure. It's how we are going to respond as a group or as an organization to a particular situation. But fidelity is how we measure our observance to these particular duties as they're laid out in the system, and how we have adhered to those particular responsibilities throughout the implementation process. The pathway, many of you will have pathways, and pathways help us to define what our protocols are, how we are going to make decisions about students based on the information that we have for them and the plans that we have in place to address instruction for academics, for behavior, and our response to mental and behavioral health services at all tiers. The pathway helps us to define what the plan will be and how we will address that plan, but the pathway alone is not evidence of fidelity. Fidelity is how accurately we have executed that plan, how accurately we have adhered to that particular pathway. I can tell you in my own experience, I have seen some crackerjack pathways with excellent evidence of use of data to establish cut scores, excellent evidence of a plan to progress monitor, excellent evidence of a plan to address instruction not only at Tier 1 but at Tiers 2 and Tier 3. The problem is that sometimes those pathways aren't always implemented as we intend for them to be. And so frequently when we go back to look at that pathway, even midway through the year, we'll find that we're not following that particular pathway as we'd intended to. Maybe we don't have the right students in intervention. Maybe we haven't been adhering to our progress monitoring plan. Maybe all of our students haven't received core instruction or intervention instruction as intended. So it's important to not only have that pathway in place, but to evaluate how we have used that particular pathway. Next slide. So fidelity to the MTSS process. Again, we want to make sure that we're evaluating fidelity of our strong leadership. As a leadership team at the state level, I can assure you that this is something that we do continually. We look to how we are engaging in fidelity to the plan that we have laid out for Project Real 2.0. We want to continue to adjust fidelity to our team approach to problem solving and to implementation. Our team approach to using data, and we'll talk a little bit about some of the fidelity to assessment in a little bit. Fidelity to the ongoing training and support for staff. So the obligation to provide high quality professional development and ongoing support to our staff doesn't go away after the first year of implementation. It needs to continue, and planning for training for new staff is something that needs to be integrated into every year's professional development plan. The belief that all students should be taught appropriate skills and then support for students based on their skill level is another component of the MTSS process that we'll continually need to evaluate our fidelity to implementation. And again, continuing to look for the fidelity in our collaboration process and in those community connections. Again, oftentimes when we're starting our implementation, there's a great deal of emphasis placed on making those connections to parents and to community. We need to ensure that that continues to take place as we become more routine in our implementation. Next slide.
When we're talking fidelity of assessment, we truly need to be taking a look at all of the pieces. We need to benchmark for our academics. We need to be looking at progress monitoring, diagnostics. We need to be looking at the surveys that give us the mental health of our school. We need to be assessing our curriculum. We need to be assessing our instruction. And we need to be assessing how we are implementing our school-wide processes for positive behavioral supports. When we are looking at assessment, we need to be also looking at the validity and reliability of our assessment data. Has our testing, administration, scoring, interpretation been done with absolute consistency and fidelity to the testing program? Have we worked with our teams, with our teachers, to be able to ensure that they understand how to interpret the data and what it means? Have we aligned our assessments to what our students need and what our instruction is? So are the assessments that we are utilizing, is there a strong correlation to what we are actually teaching? Have we utilized multiple measures if it needs to happen? You know, if we've got that data that the teacher is going, we trust teachers. Teacher is saying, okay, what this is, the data from this assessment is saying is not really what's happening with that kid. Do we have a process in place to be able to take a look at another measure that will validate either the benchmark testing or progress monitoring testing and what the power of what the teacher is saying? So do we have those multiple measures embedded? Do we have some sort of diagnostic process used to answer the question of why? Why is the child having a struggle in reading? Why is the child coming to the office every day after lunch? What kind of diagnostic or interpretive data do we have within our process to be able to start answering the questions of why?
And I would just jump in and say,
do we have
anecdotally, I think that...
Yeah.
Okay,
Go ahead, honey.
Anecdotally, I think that the benchmark assessment is actually the one that we probably have the most fidelity to, and usually that's because there is a benchmark window that we have to adhere to. Where we see some deviations in fidelity to this is that not all students are always tested. We don't necessarily have a plan for capturing those students who didn't receive benchmark assessment because they were absent that day, or we don't have a plan for assessing students who come to us in the middle of the year outside of that benchmark window. Where I would really suggest that you look at fidelity to assessment is at the progress monitoring level and at the diagnostic level. I think that's where we have the most likelihood of drifting away from the plan, because there's not necessarily a window on the calendar that you have to adhere to for those assessments. It tends to be up more to an individual or individuals in the building who are responsible for that progress monitoring and diagnostic assessment. And so I think that's where we're most likely to see some drift away from our intended plans with regard to assessment.
Thank you. Have you, within your assessment system, have you decided on cut scores and decision rules that are a part of your protocol to ensure that appropriate intervention is happening in a timely manner? Do you have a schedule for progress monitoring? Do you have some sort of a checkup system to analyze that data? Do you have some sort of, Fidelity implementation form where you are looking at whether progress monitor is happening and if the data is being analyzed appropriately? So any questions on assessment? Because that, we can spend a whole day on fidelity to assessment. Okay. So fidelity to problem solving. Problem solving is basically data-based decision making. When we are looking at data-based decision making, are we really utilizing our data? Are we utilizing our assessment pieces that have strong validity and reliability? Are we utilizing a systems-based problem-solving system, such as the TIPS, where we truly define what the problem is? Have we analyzed it? Have we set strong and smart goals using the gaps that we have identified in our problem? Have we developed and implemented interventions either school-wide or in small groups, and done that with fidelity and using reliable intervention pieces? And have we consistently put in place evaluation of how we are progressing? I think one of the things that I've seen in my practice is that we admire the data. Oh, gee, we've got 27% of our kids have had ODRs. Oh, shucks. And it's like then we start admiring the fact that we have a problem, but we have a very difficult time defining what the problem is and analyzing what steps we need to do to develop and implement change, and then systematically evaluating whether we have progressed. Have we put into place processes where we are evaluating whether we as a system are getting better, or as by groups of students, classes of students, showing significant improvement? And are we meeting our goals? Are we staying on trend to meet our end goals? I think when we are looking at problem solving, we have to look at problem solving at the leadership level, system-wide. We have to look school-wide. It's very important to look at grade level, and then moving on into individual students.
So again, we look at this pathway, and this is just an example of a pathway, but it's a reminder that not only are pathways our protocol or our plan for how we are going to respond to student needs, or how we are going to deliver our instructional plan, but it's also a way of assessing our problem solving, because the pathway kind of articulates going to respond to problems when we see that individual students are not meeting our benchmark levels of performance for academics or for social and emotional behavioral learning. And so the pathway is a good place to go back to say, are we responding to issues as they occur at each level? So again, this includes your students that are at the benchmark level, but also the intensive, strategic, as well as your advanced students. So again, I would advise you to go back and look at that pathway as part of the problem-solving process.
We need to look at fidelity to our curriculum and our instruction. It behooves us to have a research-based core program and adherence to the core standards developed by our state in the areas of reading, in the areas of math, looking at written language, but also a core curriculum that truly does address the needs of our students socially and emotionally. Have we implemented best practices in our instructional delivery? Have we systematically done staff development for our teachers so that they have the most profound and excellent strategies for active engagement, for corrective procedures? Does everyone in your building have strong mastery teaching and direct instruction skills? Is there positive feedback built in the language systematically in your building? Does the PE teacher and the secretary and the classroom teacher and the janitor all know the positive language of your building? So has the positive system of feedback become a part of the culture of your building and system? In your instruction, has everyone had the opportunity to practice, learn, and have some positive feedback in their own instructional opportunities? Have you had the staff development for differentiated instruction? Have you had the opportunity to talk about and implement some of the multiple intelligences some multimodality strategies, some overall grouping, and have you looked at some of Bloom's taxonomy? Instruction is a huge piece of what has to happen in your overall instruction. Good instruction to your curriculum. Is your curriculum being presented with fidelity, or are you kind of skipping some of the pieces that you don't like to do, or you may not have the fidelity of time to implement your curriculum, so you may be skipping pieces or hurrying through, whatever. These are all pieces that need to be looked at when you are taking a look at your research-based core curriculum that is, aligned to your state standards. Is there systematically some sort of classroom checkup for the instructional delivery? Is there systematic classroom walkthroughs, either by the administrator, by peer teachers, by teaching partners, however your school best can make that fit, because teachers need that positive feedback about their instructional delivery. And if there are gaps in that, so how has that been in your standard protocol addressed to be able to address the gaps that may be happening in instruction and curriculum delivery, both for academics and for your behavior instruction?
So finally, we just wanted to share this particular document with you because it helps to, I think, exemplify why it's so important to look at fidelity or to treatment integrity as presented in this slide. And it's somebody else's slide. You'll see the reference on the bottom. And so that's why it says treatment integrity instead of fidelity. As you'll find in the literature, treatment integrity is often used as a synonymous term to fidelity, so understand that that's how it's being used here. Because our implementation looks like this. We implement evidence-based intervention that's linked to a hypothesis. After we do so, we evaluate student outcomes. But in addition to evaluating student outcomes, we have to evaluate whether we have been faithful to the plan as it was intended. That's really, those two things together, what we mean by making data-based decisions, not just decisions based on student data or linked to student behavior, but data that's linked to staff behavior as well. We have a couple of outcomes from that. If we have positive student outcomes and a high level of fidelity or treatment integrity, we know that what we're doing is working for our students, and we know that what we're doing is being implemented consistently across classrooms, across settings, and across individual student groups. That tells us that we have positive outcomes that we want to continue with, and so we will continue our intervention. If we don't have positive student outcomes, we need to look at the fidelity of the implementation. At this point, we don't know if those outcomes are linked to student behaviors. Perhaps the intervention was not appropriate. It was not the right intervention. Or we don't know if we had the right intervention and we just didn't implement it as it was intended. Oftentimes, I'll hear things from staff members like, this particular intervention didn't seem to work. It didn't seem like it was helpful. But unless the plan was implemented as we intended it to, we don't know if the plan wasn't helpful or if it really it had something to do with our delivery of the intervention that was problematic. So at that level, the recommendation is to implement strategies to promote treatment integrity. We're not going to change the intervention at this point because if we're using evidence-based interventions and evidence-based practices, it's more likely that those are going to be effective. We really have more faith in those than we actually have in staff behavior sometimes. And so we would go back and implement strategies to promote treatment integrity or fidelity. And sometimes additional support, it's additional training, and it's additional assistance with implementing the plan so that it can be done so in a way that works for everyone, both for the staff member who's implementing and for the students who are accessing the intervention. If we have negative student outcomes, we have students who are not responding to intervention as we hoped that they would, and we have a high level of fidelity, a high level of treatment integrity, that particular intervention, that's what would indicate to us that it's time to modify or change the intervention. And we could look at this a couple of ways. We could look at this as an indication that the intervention isn't appropriate and we need a new intervention, or it could be that the intervention is appropriate, but perhaps we need to increase the intensity or the frequency of that particular intervention. So it's working, but it's not working to the level that we would like to see it in terms of meeting student goals. And so we will ratchet it up, we will make it more intense, and again, we'll go back. It's a continuous progress monitoring and feedback loop to determine whether that intervention is effective if we increase the intensity. Next. So any questions about that particular slide, or any questions about any of the content that we've covered? You can unmute or you can type those into the chat box.
Can I just make a comment? My name's Kelly from Missoula.
Please do.
Kelly. Yeah, nice presentation. I mean, you just reminded me so many times about, you know, the importance of following through with what we're going to say and do. And that oftentimes when we do have a problem, it's because we ourselves have not practiced fidelity. And so I also want to just say that on the other side of all of this, there is that piece where we really need to take care of ourselves. It's very easy to beat up ourselves because we're not doing all that we need to do. And so not making any excuses or anything like that. I think it's okay to talk with your teams about, we didn't practice fidelity. It's just the way it is. It's what happened. But yet, we also don't need to kill ourselves because we have really hard jobs, and it is difficult to maintain the level of fidelity in order to reach, you know, these high-functioning status.
Kelly, I think that's an excellent point, and I think one of the times that the intervention might not be effective is that it's nothing wrong with the intervention, but it's not realistic for our particular setting. And so I think that's one of the things that we have to look at too. I mean, again, we can have a crackerjack intervention, but if our system is not set up to support our staff, then it's not the right intervention for us. And so if we don't have the staffing, we don't have the time, we don't have the resources, we don't have the professional development opportunities to ensure that our staff can implement effectively, that in itself would suggest that maybe the intervention isn't appropriate, because we can put our best efforts towards something, but if we don't have the resources to support it, again, not a bad intervention, not a bad staff, just not the right intervention staff match.
Exactly. Yeah, my school psych just chimed in and he just said, you know, that's really what that hexagon is for, is to make sure, can you really handle it? Do you have the right resources? Is this the right intervention to tackle this problem? Because if you don't hexagon it, you might attempt it and it might not work.
Absolutely, absolutely. And I mean, I think that that's part of that problem-solving process as well, is to look at what we can do. And you know, I guess I'm speaking for myself here. My advice is usually to do what you're doing and do it well before you try to add more additional pieces to that, because I think that's when we start to fall apart. And I think just anecdotally, I think that's when we start to see a little bit of burnout in the implementation process, because not only do we feel unsuccessful with some things, but then we also kind of lose that ability to celebrate some of the things that maybe we've previously been doing well.
Right.
I would absolutely agree. I think one of the things that we always need to be taking a look at, and that is the time and the complexity of some of the interventions. You know, sometimes the easiest intervention is not something that is hugely complex. It can be as, you know, simple as setting up some sort of a reteach situation for, you know, either behavior, reading, whatever. But it's a matter of, sometimes I think we as educators go to the complex and we make it way too hard. And that's why, you know, tackling something that we can actually do in the time we have, that we are confident in being able to implement, can give us a bigger bang for our buck instead of doing the real complex, sometimes very expensive interventions. And take care of yourself. I agree.
Any other questions or comments? Those are great points. Okay, I'm going to read from the chat box. Christy Pierce from Capitol High says, do you have an academic pathway example for the tiers of intervention, but primarily tier 2 interventions, primarily for interventions in sciences and social studies at the high school level for students with reading deficits? I do, Christy. I mean, I can share with you what we're doing here at Bozeman High School at Tier 2 and Tier 3 with regard to addressing reading in the content areas, if you'd like to see that. But I would say it's not. We're looking at kind of Tier 2 and Tier 3 interventions, so it's not necessarily differentiation per se. It's kind of a different pathway, but I can share my pathways with you. So I'll share those unless I hear otherwise. I'll share those with Christy individually, and then if anybody else is interested in those, they can contact me as well. Anything else?
Shauna, it's Troy from Missoula. How are you guys all doing?
How you doing, Troy?
Good to talk to you. One question I had for you, and a lot of the Fidelity talk, it seems that you get a little bit of resistance or pushback from members of staff. How have you seen a steadfast drive towards Fidelity impacting the level of resistance or pushback from the process?
You know, I'll just answer anecdotally. I think that personally, I wish they'd get rid of words like fidelity and treatment integrity, because I feel like both of those kind of sound like bad words to people. And in my experience, I haven't seen people not adhere to fidelity in any kind of malicious, malevolent way. I think there's very few people that say, I'm not going to do that. I think the point that was brought up earlier that that sometimes it's just hard to do it is actually what happens more frequently than not. A couple of things that I think are really important when we're approaching this with staff is, first of all, to have that consensus foundation so that everybody, so that we have a general consensus for our staff that our implementation efforts are important. And when we talk about adherence to those implementation efforts, that's part of the process. So if you have good consensus amongst your staff, I think that helps. And I think that when we talk about fidelity or integrity, we have to talk about it in a way that ensures that people have trust in how the information is being utilized. To me, these are never questions about whether people are doing what they're supposed to do. It's whether the system is supporting people in doing the work that we expect. And so I like to think of it not as fidelity to fidelity of the staff, but more about fidelity to the system. And so as a leadership team, I think we take that on ourselves to say it's our job to ensure that we're implementing with fidelity, and part of that is ensuring that things are being implemented in a way that works for the people that are implementing it. And so if things are not being implemented as intended, if we see poor treatment integrity or poor fidelity, that's probably on us as a leadership team to problem solve more so. So I guess I would try to take more ownership of that as a member of the leadership team to problem solve that for my staff.
That's terrific. Thank you.
And I think sometimes as a leadership team, we need to ask the question of staff is, what is the barrier? And sometimes validating the fact that, yep, there's not much time, and no, I haven't had staff development in that area. I think as a leadership team, listening to the staff and assisting them in figuring out what the barriers are that they feel before they want to implement something or start blocking it. It's like a lot of that happens because of fear, because they have not had the opportunity to really acknowledge the barriers that they are seeing in the implementation. And sometimes as a leadership team, it's just truly a matter of listening to them and giving them the support that they need to move into implementation rather than blocking.
Did that help, Troy?
Yeah, that's terrific. I appreciate that. Thank you very much.
That was a pretty vague answer to a really tough question, so
Yeah.
hopefully it helped a little bit.
Yeah,
That's a very good question.
yeah, I
That's a very
It's an
good
excellent
question.
question.
The reason I ask is that I think a lot of times for leaderships, you know, you hit on the fear aspect. A lot of it seems to be for leadership teams. It seems that fear of just even running the chance of pushback is enough to almost derail the leadership team's fidelity in the approach. So that's kind of why I asked. So it's terrific response.
Well, and I think part of it, I mean, I think the way, it's how we approach data in general with our teams, right? There's no such thing as good or bad data. If we have academic data that we don't like, if we have behavioral data we don't like, it's not about individual teachers or individual kids. It's about a system that's not working for the teachers and the kids that are in it. And so that comes, so it's always that dispassionate review, I guess, of what's going on. And so to the extent that we can kind of distance ourselves from that it's not a personal thing, it's not a kid-centered thing, it's the way that the system is set up. And I like that. I think it's some other presentations where we talk about the results that you're getting, your system is set up to give you the results that you're getting. And so I like that because it's the emphasis on the system, not on the teacher or on the kids.
I think as educators, we often take ownership of gaps in the education, whether it's behaviorally, whether it's academically, and that then can move people into feeling like they're being blamed by using just the data. It's a matter of, you know, this is what it is. This is what's real for our school today, you know, and then moving into problem solving. And so what can we do about it? We have a problem, and no shame, no blame. But it's like now we have to do some sort of analysis and move into action steps as to fix the problem. And, you know, nobody doesn't want to make things better for kids. But we have to present it so people are not feeling like they're being blamed or like it's, oh, look at that third grade or look at the ninth grade science. You know, that's not the way we want to approach it. It's just what is. And, you know, then allowing people to have some ownership of the problem-solving process and the analysis, and then moving into developing what can fix this. How can we get our kids back on trend? Does that help a little?
Yeah, absolutely. Thank you.
Sorry, we're having a real hard time hearing you.
Oh, yes. Thank you very much.
Okay, if there's no other questions or comments, I did see some things in the chat box about adding our pathways. I'll put a little bit of description in there just so you guys can kind of, I'll have the pathways, but also kind of what we're trying to accomplish through those. So I'll add some descriptions. It'll take me just a little bit to do that, and I'll get those in the Moodle for you guys.
A question I wanted to ask administrators. Oh, and that's if administrators need samples of walk-through forms or if they already have things in place. We'd like you to share those with us also. Okay, Shauna, continue. Just interrupted you.
No, that's okay. I think that's all I have.
All right, thank you, everybody. Thank you for Shauna and Susan's presentation on Fidelity. And if you have comments, there's their email addresses, so I'm sure you can get back with them as they share something that you would find helpful to you in your process.